One of the things that has been enlightening to me as a host of this show for a few years is some of the information in the medical field that continues to change and grow, and all of us as patients, especially as we put on a few more years, become hopefully a little more sophisticated in some of those things the doctors are doing for us, and the doctors certainly are doing a much better job than they were 40, 50 years ago as far as communicating health information with us. Our next guest is one of those people who's very good at communicating medical information. Dr. Thomas Hirose is back with us again today. And one of the things we've all learned about now is when we get those blood tests done several times a year or once or twice a year, depending on the doctor and person's health condition, all those numbers and facts and cholesterol and all that. But one thing that they do look for sometimes, especially if there's maybe some questions about our health, is platelets. And we've talked a bit about that. Platelets is one of the components of blood. Talk about platelets, what they are and why they're important, and what those numbers all mean.
Yes, as part of the complete blood count, you have the white cells, the red cells, and the platelets. The platelets is a unique cell that helps us to stop bleeding. And what a marvelous system. You have the union of two completely separate systems, one being the liver, making clotting factors, who then unite with a cell that's produced in the bone marrow, which is called a platelet.
Mm-hmm. So if we cut our finger or doing some yard work and hurt ourselves or whatever, that's what helps to form that little crust, so to speak, and helps heal that wound?
That's correct. So the clotting factors assemble on the surface of the platelets, and they form a web across where the injury occurred. Mm-hmm. And so that's one of the cells that we look at in numbers, and we also look at how well they're functioning.
Okay, so you can actually check their, if you will, the health of those cells?
That's correct. So that the cell, once released, we can put them in a test tube and measure how well they're able to clump and to form a clot.
Now, our bodies are that way on purpose to help us not bleed excessively if we hurt ourselves. But for a lot of people, as a preventative measure, primarily for coronary issues, a lot of us take that baby aspirin, 81 milligram aspirin once or twice a week or more, as some people. There's medications like Plavix, I believe, and others that come along that as well as keeps those from clumping up inside our body. We don't want them to clump up in there. Does that also have an impact on if we get a cut? Do we tend to bleed more if we're taking those products?
It does, and coagulation is such a sensitive balance between clotting and bleeding that when we tip the scales one way, you could cause more bleeding or more clotting. So that's a very good example that as we get older, we have a higher chance of forming a clot in our heart or in our brain. So then past the age of 55, we recommend using either a low dose or a regular dose of aspirin so that those platelets don't accumulate inside the blood vessels of the heart or in the brain.
And then we know you as someone who does a lot of testing for Coumadin. That has a similar function within the heart itself, correct?
It does, and the general pattern is that in arteries, the platelets are much more influential, whereas in veins, it's actually the clotting factors from the liver that are much more influential. And interestingly enough, the heart itself acts like a vein. So inside the heart, we prevent clots from forming for prevention of stroke by using Coumadin, whereas in the blood vessels of the heart, we use antiplatelet agents. Now, Plavix is 20 times more powerful than aspirin is. So in instances where we really cannot tolerate any clots, such as if you put a stent inside the coronary vessels, it's very important to have this very powerful antiplatelet agent.
So platelets are obviously a very important part of our blood. We've talked a lot about blood donating and the new system that you're running over there, the new operation at the Saddleback Hospital. We talked about this briefly, but while people can donate whole blood, some certain special people also have a little more time and are willing to actually donate platelets as opposed to donate whole blood. And I guess you need both, and you can obviously take the platelets out of whole blood, but sometimes we need more platelets than blood, so you want people that donate platelets, right?
Yes, and I would say that discovery of using blood is one of the top 10 discoveries of the 20th century, and just right behind it is our ability to selectively take out platelets from donors and use them where patients either do not have enough platelets or the platelets aren't working. So what comes to mind is if you have chemotherapy, one of the cells that disappear are the platelets. So we support them by giving those patients platelets from someone else. But interesting, I just said that our recommendation past the age of 55 is to go on aspirin. So if you should be in an automobile accident or you should go to major surgery, your platelets aren't working. So then in those instances, we pull off from the shelf a dose of platelets and we give them to you, and that tips the balance so that you don't bleed out.
And I know that a lot of times if you're going in for, say, a colonoscopy or some other procedure that might inflict a little slight wound either in your throat or in the other end of you, they ask you not to take aspirin for a certain number of days before those tests.
That's very important because almost more than holding Coumadin, the platelets in those selective sites really makes a difference. So that's yet another instance that if you had a biopsy and it had uncontrolled bleeding, we would have donors giving platelets so that we could correct that.
The process is similar to donating blood. They put a needle in your arm and take things out, but the other side of that is they put things back in, right?
That's correct. And it's a special machine that's a centrifuge. Blood comes out of the arm, it goes into the centrifuge. Red cells are on one side, platelets are another, and we selectively say, do we want the red cells or do we want the platelets? The whole process is slightly longer than routine blood donation, which is about 45 minutes. Platelet donation is right around 2 hours.
So somebody has to have a little more time.
Yes.
And again, if they're going to donate platelets, you don't want them taking aspirin for a few days before, right?
That's correct. Aspirin or Plavix needs to be stopped several days before.
So somebody who's on a regular Plavix regime might not be a good platelet donor.
Yeah, we would welcome them on the red cell side since
Right.
we don't have to worry about
Right.
that.
So if someone should donate regular blood, they could be taking their regular prescriptions and
Yes.
all of that.
Yes.
Would there be something anyone could take that would be a negative for blood donation?
We use medications as both a marker and substances that we wouldn't want to give the recipient. So as a marker, if a donor is on insulin, it tells us that that their nerves may be impaired. And what a marvelous system. If you lose 10% of your blood volume, your blood pressure, respiration, and temperature do not change. And it's because your autonomic nervous system clamps down. In the case of an insulin-dependent diabetic, sometimes those nerves, the automatic nerves, are injured, and you lose the capacity to clamp down. So it's a marker of a patient that shouldn't donate blood volume. The second part is that if you are, in the case of platelets, donating, then if you're on aspirin, it's a indication you wouldn't want to donate because your platelets are impaired.
Right.
If you're on chemotherapy, we wouldn't want those substances to go to a recipient.
Yeah.
So that's yet
Yeah.
another
Yeah.
indication, yes.
And they always do a couple little tests along the way. They check blood pressure, and they do a little stick on your finger to make sure, I think it's the oxygen level they're testing.
It's primarily to look at the count,
Red
make
count.
sure you have enough red cells.
Okay,
Yes.
all right. A lot of the things involved, and I think a lot of people are concerned about the safety aspect as well, so much more so in recent years with HIV becoming such an important medical concern. I understand for blood donation and platelet donation, you only use the equipment once per patient, per
Yes.
donor.
From the very start, from the needle all the way to the bag and to the end, everything's all disposable.
Right, right. So, and then you get your cookies and your juice after that.
That's right.
Do they get cookies and juice for platelets too?
They certainly do.
Okay, very good. Well, if you're interested in either being a blood donor or a platelet donor, I know you folks are having those facilities available over there at Saddleback Hospital.
Yes, we're making preparations on the platelet side, but that'll be in the very
Good.
near future.
That's great. And the blood that's donated is used mostly right there at Saddleback.
It's all used right at Saddleback Hospital.
Right. Well, we want to make sure everyone's nice and healthy. And the other aspect of your work, of course, is in the Coumadin clinic, which you operate as well. And those levels, periodic tests on some things, but that's a very critical amount. It's got to be just the right, not too much, not too little, just the right amount, and that's why that's tested pretty regularly.
That's right. We make sure that you're in the therapeutic range and that you're in the safe range.
Does that depend on, does it change with each patient?
It does, and so that's why we look for sticky platelet syndrome, or we look for other reasons that would be abnormal clotting to give us an indication what range we really should use in our anticoagulation.
We know you operate the facility there at the hospital. Where is your Coumadin clinic in relation to the hospital?
It's just right across the street.
All right, so you're going back and forth.
That's right.
Keeps you a busy man. How often should Coumadin patients get tested?
The longest interval is 4 weeks, and most of the patients can go that duration. The data speaks, though, that if you have problems in being in the right range, it may be as short as every 2 to 3 weeks.
All right. Dr. Hirose, always a pleasure. Thanks for coming by. Gentleman who knows a lot about our blood and the important things that go into our blood, and some of the chemicals we put in our bodies as well have some impact on our blood as well. We'll be coming back with more as our program continues for this Wednesday.